So your MRI shows you have a herniated disc and the doctor doesn't want to do surgery. Why is this? Well, my name is Dr. Story. I've been a chiropractor for over 23 years. I'm going to give you realistic advice based on my experience. You know, people view MRIs as it's written in stone, like it came down from a mountain. The information came down from a mountain. That isn't how MRIs work. MRIs are simply a fancy picture of your spine when you're not moving, when you're lying down. So a good surgeon will very often be very careful about who they do surgery on because they want to have success. They're human, they want to have success. Now, of course, there's butchers out there, but the reality is most of the surgeons I personally know are very good doctors and will only try to do surgery on patients who it absolutely is necessary for. So I'm going to give you a perfect example of why, even though you show a herniated disc on an MRI, you don't need surgery. Number one, the disc herniation is not even on the side where you're having the symptoms. It is extremely common for a patient to go into an MRI machine and they have radicular pain down the right side, let's say, and they have sharp shooting, stabbing pain going down their right leg. The MRI results come back, you have a herniated disc. And the patient goes, oh, thank God we finally know what's wrong with my back. You know, thank God we did that MRI. Well, it turns out the disc herniation is on the left side. And so I actually, many years back, was just discussing this with one of the top surgeons in our area, very well known, very well respected, had 30 years of experience doing spinal surgery. And I asked him point blank, how come when patients have radicular pain down the right and the MRI shows the herniation on the left, why is that? And the top neurosurgeon actually said to me, some things we just have no idea why these things occur. Even the top surgeons don't know why it occurs sometimes. So, but when the surgeon sees that the disc herniation is on the left side and the radicular symptoms are on the right, they know that there's some other cause for those symptoms. And doing surgery on the left side to cure a right-sided problem doesn't make sense, and most surgeons are going to stay far away from doing that. The second funniest thing that actually happens with disc herniations is the patient will have radicular symptoms down the right leg. They have sharp shooting, stabbing, shock-like distribution of pain down their dermatome, down their right side, and they have a disc herniation. But the disc herniation is not even close to the nerve where they're having the symptoms. So they have a disc herniation, let's say, at L3, and their radicular symptoms are down the L5 dermatome. Doesn't make any sense. So that's a reason why they very often will not do surgery on those disc herniations, because those disc herniations are nowhere even close to where that nerve is. Number three, this is a great one. The patient has back pain but no radicular symptoms, no pinching of a nerve whatsoever, and then they actually have an MRI and then it comes back as a disc herniation, but they don't even have radicular symptoms. So the reason why these three examples exist, and I'm telling you this, is because MRIs very often give what's called a false positive. And what this means is it finds something that's wrong with you, but it's actually not clinically relevant. I always tell patients this: think of an X-ray as a very bad photograph, like a Polaroid, or if you were to look at yourself in a reflection of a mirror, you would see how good looking you are. And you would look at yourself in that reflection of the mirror and you would say, wow, you know, that's a picture of me. Well, that's what an X-ray does to the bones of our spine. X-rays don't give you the entire picture, do they? They don't tell us about discs, they don't tell us about soft tissue. All X-rays do is tell you about bones. So you look at the reflection of the mirror and you think to yourself, okay, I look pretty good. Well, an MRI is an extremely well detailed picture, very different than what you see on an X-ray. An MRI can tell you about the discs. It can tell you about some muscle, not function, but muscle structure. It can tell you about ligaments. It can show every little single detail. Well, that's a problem, because instead of a Polaroid picture, think of an MRI as like a vanity mirror. So imagine a young person who's self-conscious about how they look, and you put them in front of a vanity mirror with all those lights all around, and they can see every little pore, every little dysfunction, everything wrong with their face. In 10 minutes, they're on drugs, crying hysterically, full of depression. And that is what an MRI does to people. Is an MRI gives you every little detail as if you're looking into a vanity mirror. But no one looks at humans as if there was a vanity mirror. The reflection in the window, you're a good-looking person. And that's exactly it. An MRI will show every little disc herniation, every little disc dehydration, every little degenerated disc. It'll show every little pinching of the nerve. It'll show everything, but that doesn't mean that's who you are. So MRIs give a lot of false positives, and very often this can send you down the drain of depression because you think those are things that you have. But that's why a surgeon will very often not do surgery on a herniated disc, because it's just a finding on an MRI and it's not clinically relevant.